My name is Dr. Ryan Myers. If you've attended one of my webinars before, you know that I'm a clinician, and I own a clinic in Utah called the Movement Clinic, and we work with chronic illnesses and functional medicine. I also teach on ozone as well as hyperbaric oxygen therapy and other conditions and other uses. And so today we are going to talk about mitochondrial health and mitochondrial dysfunction and how ozone, as well as some other things, can really help and affect that. And so the goal today, if it's good, somebody already asked about SIRS. I work with SIRS and I'm a SIRS clinician. We'll touch on that today. So the way this works, go ahead and put your questions in the chat. If we have time at the end, there's some of those, but you can also reach out to us through me or through Metaskill, and we can tap into those. So let me switch over here and pull up the slides. And let's get going. So as I said, today we want to talk about mitochondrial health and mitochondrial dysfunction and how ozone therapy and others can really help as far as what that means with the cellular energy, disease associations, as well as therapeutic interventions. I do like to say nothing that we share today is medical advice. I am a doctor. I do treat and use these therapies. But I always recommend, whether you're working with a clinician or trying to find someone to work with, please do for your specific use cases. But let's dive in. And so the objectives today first are, we hear about mitochondria all the time, all the way back from high school biology, hopefully. But I want to just touch on some review of what are mitochondria and what are their roles and why they're so important. As well as we'll touch on some challenges in diagnosing and treating mitochondrial dysfunction, especially from a conventional medicine standpoint. And then we're going to explore ozone therapy and how it can support mitochondrial health, as well as how to look at it from a integrative treatment approach. Because I believe always that if we're not assessing, we're guessing. So we need to know how to diagnose what's truly going on. And then nothing is a sole treatment option. So really it's how does ozone fit into an integrated plan? And we'll touch on that and give some insight to that. And then we'll go from there. So strap in and let's go today. So I love this because I feel like every time I meet with anybody, and I just presented a couple weeks ago at a conference in Florida, and everybody remembers that in high school biology, mitochondria was taught as the powerhouse of the cell. This is what they look like. And so the main purpose of mitochondria, and again, this is probably a review for most of us, but it's good to talk about, is mitochondria generate ATP. And ATP is the molecule of energy in our cells and in our body. Now, when I talk with patients, I get really specific and sure that we mention that just because we're producing more cellular energy doesn't mean I have energy to go throughout the day. That's a byproduct, but it's the energy for cells to do their job. And if we can increase cells' ability to do their job because they have fuel, they have energy, then cellular function improves, cells make up a tissue, so tissue function improves, tissue makes up organs, so organ systems improve, and then organs make up systems in the body. And so we're actually able to really address and improve systemic function by enhancing mitochondrial function. And so ATP is produced both inside and outside the mitochondria, but mostly inside, and that's where we get the most production of it. However, all ways that ATP is produced require oxygen, amongst other things, but oxygen is the universal ingredient. And so I always tell patients that if oxygen is the high octane fuel your cells need to do their job, we have to figure out how to get a fire hose of oxygen or these other byproducts into our mitochondria so they can do their job. So let's talk about what mitochondria's role is in oxidative stress and or what we call redox signaling. So oxidative stress is an interesting topic. We're going to touch on this, but I feel again that oxidative stress is kind of one of these, it's becoming like a social media-y, Instagram-y type thing. Oh, we have to get rid of oxidative stress. Well, let's talk about really what that is. So really it comes when there's an imbalance of what we call ROS, so reactive oxygen species, and the body's ability to neutralize that through antioxidants. So ROS are a byproduct of ATP generation. So in minor amounts, ROS is good because it stimulates the immune system to come in and do its job. And so we're going to look at this because ozone can produce ROS, but we need it to a point to stimulate the immune system to come in and clean up and do its job. However, what happens is we need antioxidant activity to neutralize those. So when those get disrupted, ROS levels get too high and now they can cause damage. So this is where we get oxidative stress to cellular components, DNA, etc. So this is one of the main things that can contribute to unhealthy aging. I'm going to put a caveat there because it says aging. I actually don't like the term anti-aging because we're all going to age. So it's more about aging well. So this excessive oxidative stress actually contributes to unhealthy aging. We know it's tied to neurodegenerative conditions as well as these other chronic illnesses and diseases, many of which a lot of you are using as home users or using to help with as home users or clinicians using to treat. And so then let's talk about this redox signaling. I feel like these are, redox is a term that's probably heard less than oxidative stress, but they're tied together. And really what that is it's a cellular communication system. So really it's helping to signal between ROS and the immune system to fight inflammation, help regulate mitochondrial control. And so this is that balance between antioxidant support so that we can have proper adaptation to stress. We can help heal tissues. We can produce energy effectively. So mitochondria, yes, we produce ATP. We get these byproducts that if not kept in control, we get improper signaling and we get damage. If we have this balance between ROS production and antioxidant activity, this redox signaling communicates the whole system to work in a way so that we can stay healthy, have good tissue health, good cellular health, and prevent unhealthy aging. And so that's what we say here. So again, this dysfunctional mitochondria, or what we start talking about mitochondrial health or mitochondrial disease, which is a whole nother category, but it's when we produce this excessive ROS, so this reactive oxygen species, and we have not good or improper antioxidant activities. So therefore we lead to chronic inflammation, energy deficits, and we have this accelerated unhealthy aging. And so, yes, we have this powerhouse of the cell. Its job, just like any power factory, power plant that we have on, that to produce energy for us, we get the energy out, but then there's byproducts. And if our body is unable to manage the byproducts in a proper way, then we get dysfunctional mitochondria, we get breakdown, and we get this imbalance of inflammatory products that lead to all the health concerns that can come from this. I want to talk for a minute about mitochondrial dynamics. I don't think this gets talked enough about in mitochondrial health, but this is part of how mitochondrial functions to help our body. And so there's 3 different ways that mitochondria is dynamic, meaning how it changes shape, how it responds to the needs of the cells, and that's through fusion, fission, and mitophagy. So for some of us, this might be a little new, but I feel like this is important. So we're going to address these. So mitochondrial fusion is where two mitochondria merge to form a larger, more efficient organelle, mitochondria. So what's the purpose? If we have damaged ones, they can come together to produce a healthy one. And this has to happen as mitochondria age or they're damaged due to some of these imbalances or illness. Fusion brings the two of them together to create a more powerful, healthy mitochondrion. But the disruption of this is what we're talking about. So when fusion is disrupted, we know that there's links to acceleration of neurodegenerative diseases like Alzheimer's and Parkinson's. And so again, we have to know as we start seeing symptoms of this decline and understand what those are, that we're dealing with mitochondrial dynamic issues, mitochondrial health issues, and we've got to support that. So secondly would be fission. And so this is where a single mitochondria splits into two smaller ones. So this is to create growth. We want to have more mitochondria, and hopefully this is removing damaged sections. So unlike fusion, if we have excess fission, so now we're dividing mitochondria more than we should, this rapid division, we actually get mitochondria that are formed in fragments and they're not formed properly. And so they call it mitochondrial fragmentation, but it's almost like the body is now reacting where it's dividing mitochondria faster in a way that it should, so the division doesn't happen properly. And we know that this can be tied to conditions in the metabolic disorder category, as well as different cancers out there. So same concept here. We've got to support healthy fusion and healthy growth and division of mitochondria. Because if the body is not responding well to either of those, we're going to have improper functioning mitochondria, which can lead to these conditions. And lastly would be mitochondrial mitophagy. And so what this is the body's natural way of kind of getting rid of and recycling these damaged mitochondria. So it's its own garbage cleanup process. So we're not accumulating dysfunctional mitochondria. The body's natural way is to go through and get rid of these damaged ones. But if this process is disrupted, then now, yes, like we talked about, we're producing more mitochondria, or the aging ones aren't being able to join or get rid of. So now this is what leads to the unhealthy aging process. Cardiovascular disease, diabetes are some of the few. But also a lot of this just leads to poor mitochondrial function, which leads to a lot of the symptoms that go from this. And we're going to talk about some of those. And so let's talk about how this all works, because it's not just like we wake up in the morning and our mitochondria produce ATP. We have to give our body the right fuel. So glucose, fats, ketones, these are the things that we have to be taking into our body through diet, hopefully mainly through supplementation where needed, so that our ATP literally has the ingredient, or our cells and mitochondria literally have the ingredients they need and are able to get into the mitochondria to produce ATP on the outside. And so we have to have these nutrients and cofactors. Again, nutrition, nutrition, nutrition. Your daily diet is by far and away the best way to do this. However, sometimes based on what you're going through, we've got to do some supplemental support. Oxygen availability. So again, this is now where we've got to look at different therapies potentially to help do this. And really, what is our body's oxygen utilization so we can do this? And then we have to minimize the mitochondrial oxidative damage. So from right away, you can see here that to produce ATP in a healthy way, it has to be an integrative approach. We can't just give everybody ozone. We can't just give everybody HBOT. We can't just give everybody CoQ10. We have to look and understand truly what the deficiencies are, what they're caused by, and then how can we bring those together in an integrative plan, protocol, or experience for the patient in front of us or in our home, so that we can know how to heal our mitochondria and improve their function and their dynamics so that we can live in a healthy way. So what are the biggest factors that lead to mitochondrial damage? So there's several, but we can really kind of lump them in these three categories. We know that environmental toxins can impair mitochondrial function. things like heavy metals, pesticides, molds. There's so much that we're exposed to now in our world that 100, 200 years ago, we were not exposed to as far as an environmental toxin place. For instance, there's certain bacterias that are produced from or activated by water damage in a home or in a building called actinobacteria. And we know they create these little tiny particles that clog the holes or the channels in our mitochondria so that things can't get in there. And so now we have to understand that. So if we know a patient's had exposure to environmental toxins, we know how to assess and test and then properly treat. And infections of any type or kind. So, bacterial, viral, fungal, any type of infection can disrupt this process because of how they throw off inflammation, because of how they can turn into chronic if we have an imbalance in chronic infection or chronic inflammatory state. But even acutely, these are some of the things that we've seen. You want to talk about the last 5 years that we've dealt with COVID, that viral infection acutely can disrupt mitochondria. And if we don't heal properly from that for a variety of reasons, and we did a webinar on that, then that can turn into chronic mitochondrial health issues because of what's happening from that infection. And then probably the biggest one that we all can control and take steps to control today would be lifestyle factors. Poor diet, sedentary behavior, chronic stress. These are all things that we can take steps towards to help to minimize this oxidative stress and the things that are going on in our body. We talked about diet to bring in the ingredients our body needs. Healthy activity helps to improve oxygen utilization, so we're getting that in and increases mitochondrial growth. And then stress just drives the whole system. So as we look at all of these things, this is what leads to it. The challenge that we face today, especially clinically, and I will say most of the patients that I have coming in are dealing with a combination of all of the above. They've had some environmental exposure, they've had some infectious exposure, and they're dealing with some lifestyle factors, be it self-imposed or outside. And so it's how do we create an integrative approach to address all of these? And again, we're talking about ozone today. I will tell you, ozone is amazing in all of these categories. And we're going to dive into that a little bit today, to give you a little bit of an introduction to that. So what are the conditions associated with this? So this is where the way I talk about it in my clinic is people come in with name tags on, a diagnosis. And there's some chicken or the egg, but typically it's before you got to a neurological disorder that has a name or a chronic fatigue syndrome or an autoimmunity, something had to happen underneath. There is environmental exposure, there is an infection, there is a combination of all of the above that started to trigger issues. And now it's moved down the chain far enough that we can give it a name tag of a diagnosis. But going after the diagnosis alone is not necessarily the answer. We have to look at what caused the issue, what led to where we are now, and then come back and really handle root cause and how the mitochondria are affected and what do we need to do as far as what the rest of the immune system and how the body is reflected. So you can see here are conditions that we know, and there's good evidence out there that are associated with mitochondrial dysfunction, where at some point there is some type of exposure, inciting event that triggered a mitochondrial dysfunction, that triggered an immune system and a hormonal dysfunction that now is leading us down the road to things like Alzheimer's or Parkinson's, to things like type 2 diabetes. And then these chronic fatigue syndromes, fibromyalgias, these conditions that until we understand what's going on underneath the surface, it's really hard to truly be able to treat them the way that we need to. Which ties into what I was just saying. Conventional medicine has some amazing tools. One thing that's important to know about my approach is I am a believer that there's a blend at all times, but it's also understanding the limitations of all approaches to medicine. And I will say that one of the biggest challenges of conventional medicine is we usually attack things from a symptom or a lab value standpoint, meaning you have a symptom, so here's a medication, or you have a lab value, so here's a medication. So it's this symptom lab value centric approach, which those things don't necessarily tell us what's going on. It's just what's bubbling up to the surface. I love the analogy of an iceberg where we know only a small percentage of the iceberg is above the water. Symptoms are what are above the water. Everything else is underneath. So if we're giving a prescription or a procedure to what's above the water, we might be able to chisel that down a little bit, but the iceberg is going to continue to form because we're not dealing with the roots underneath. And I will say, even in a functional medicine and an alternative medicine world, that community is trending this way as well, except now we're going to give a supplement to a lab value or to a symptom, or we're going to give an IV to a lab value or a symptom, instead of saying, well, what's causing those? What's under the water? And how do we support that so we can take care of the whole iceberg instead of just dealing with what's above the water? And which talks about diagnostic limitations. A lot of our standard lab values, a lot of our standard ways to test don't really give us true vision into mitochondrial impairments. So this is where we got to understand how to look and where to look, looking at measures like anion gap and understanding what that means, looking at testing things like actinobacteria, if we know that they can cause this, as well as they're, doing low level or VO2 type testing, or even RMR type testing, so resting metabolic rate. Those can actually give us really, really clear insights to mitochondrial health. And so knowing how to test this, even though it's in a quote non-conventional method, is what's going to really help us understand. But then also looking at root causes and exposure and those things, we can know that because of those, we're having mitochondrial impairments. And then there's just lack of awareness or training. I feel like it's being talked about more, but we're still in this world of, oh, if you are deficient in this lab value, we're going to give you this, instead of saying, well, why are you deficient in that lab value? Lab values should assess or inform the process, not be the process. So those are a lot of the challenges that I see in my world as to why we're struggling to truly identify mitochondrial dysfunction, and or really we are identifying it, but how to understand how it got there, why it's there, and how to fix it. So let's get into ozone. So again, a lot of you here are users or clinicians, so familiar with it. So we'll just do a quick little overview, because I think that's always good to understand. And so what is ozone? So ozone is a molecule. Oxygen is O2. Ozone is O3. So what does that mean? It means we throw oxygen into these generators, we throw some current at it, and it breaks them up, and then they join together. And so we have these three molecules of oxygen together into what forms ozone. And so it becomes this highly reactive molecule. And it has antimicrobial properties. It does a lot of amazing things like break down biofilms, increase oxygen utilization, stimulate immune response. It does this through a variety of different mechanisms. The biggest ways to use ozone, and again, are probably the number one most accepted for efficacy, for safety, and systemic support, is what we call major auto chemotherapy, or otherwise known as an ozone IV therapy. And we know, and here's some great articles, and we'll send these out, but to talking about what MAH is and how it works. But the number one systemic way to do this is through IV. And we know you're getting mitochondrial support from there. The number two most effective and tied to systemic support would be rectal insufflation. This is probably what I would say most home users are doing. Because of what it's doing, it has an amazing modulative effect on gut biome. However, it also helps with systemic inflammatory conditions and to dampen that. We also can use it for a number of conditions that are related to ear, nose, and throat. So there are ozone and nasal and ear insufflation protocols that you can use. I would say I've used all of the above for acute and upper respiratory infections, as well as neurological support for things like cognitive and brain fog, for headache, migraine, for TBI, for things like Alzheimer's, et cetera. This is another great home usage. However, we do this in the clinic as well. Ozone has been amazing for tissue healing. And so healing wound and wound care. So things like limb bagging, where you're actually putting a wound inside of a bag and pumping ozone through it, can help heal. And then there's great topical applications. I will tell you, we have ozone oil in our house. And my 12-year-old daughter will go through that because she puts it on every scrape, cut, rash, eczema, bug bite, et cetera, and they all go away faster. There's plenty of other ways to do this. There's ozone capsules. People will ozonate water. In clinic, I do quite a bit of ozone injections for tissue healing. What's cool is the molecule that is ozone is so amazing that it can be used in all these categories and have a benefit for what we're trying to get after because of how it works on a cellular level. It's not just specific to one type of tissue in the body. It can enhance any or all tissue or system in the body. So it's key mechanisms. First and foremost on here, mitochondrial support. That's what we're talking about today. And again, increasing that oxygen utilization, which what we talked about, all mitochondria have to have oxygen in order to produce ATP. But then on here, it says reducing that oxidative stress. I will say modulates or balances that oxidative stress to get it to a place that we have healthy antioxidant activity and we're helping the immune system function. Mixed with that, we know ozone helps with the circulatory system. It can be a vasodilator. We can help get blood flow to more places, as well as then bringing more oxygen, more nutrients to where we need it. We've talked about immune modulating quite a bit, and I love this concept of immune modulation because, as you know, if someone's already living in a height or an overactive immune state, I don't want to enhance it. If someone's living in a underactive or a suppressed immune state, I don't want to suppress it. I want tools in my belt that can modulate the immune response. So despite or regardless of where the patient is, modulating brings it to the middle. So we're balancing that immune response and immune function back to where it should be so it can function the way we need to. This oxidative preconditioning, this goes back to what we talked about with the ROS and redox signaling, where ozone can help to trigger this antioxidant response. So protecting our cells as well as reducing this oxidative stress and keeping it balanced. We've talked about antimicrobial, but again, it's effective against fungi, bacteria, viruses. And so I love using it acutely with patients and ourselves at our home who, you're sick, you've got a cold, there's something going on that way, or we're dealing with chronic infections. This is where ozone, I feel like, really shines, is dealing with these chronic Lyme infections, these chronic biotoxin and or mold issues, this long COVID. It's amazing for those. And then it kind of ties it all up as it's an amazing detoxifier. So it actually enhances liver pathways as well as the cellular detox pathways. So we can do a good job of fighting, killing inside, but if our body doesn't do a good job of getting rid of it, all of those inflammatory byproducts get reabsorbed. And so ozone is amazing to teach the body how to get those out, collect them, and take them to the toilet so that we're getting all that out of our body. So now let's talk about how all that applies to mitochondria, our topic of today. And so this oxidative preconditioning that I just mentioned, so this ozone therapy, we want it to induce a little bit of mild oxidative stress like we talked about, because if we do that in a controlled environment, which ozone's able to do, then we upregulate the antioxidant defenses. So this is where often you'll hear us say ozone has what's called a hormetic effect, which means it's a slightly stressful effect. And that's on purpose because it induces this mild oxidative stress so that the body will upregulate antioxidant defenses to come manage this oxidative stress, protect our cells, and help our body to do its job properly while managing that stress. I love this concept of mitochondrial biogenesis. We talked about fusion, fission, and mitophagy, but ozone is known to be a mitochondrial biogenesis supporter, meaning it stimulates the production of new mitochondria. So as our body's helping to get rid of the old and protect the old, we've got to have new. But also we know that as we are dealing with chronic illnesses, but also just as we age, as we get older, we know your body will have less mitochondria. It's how our bodies are built. But we know we can age well, age healthier, and be able to prevent some of these cognitive neurodegenerative illnesses and chronic illnesses if we have more mitochondria. And ozone definitely helps to do that. And then anti-inflammatory. One of the biggest ways any cell in our body is unable to get the ingredients it needs inside, be it a hormone, be it a nutrient, whatever, is because inflammation comes and fills those little sensors or those little portals on our cells. And so we have to get rid of inflammation. We have to fight the inflammatory forest fire. And ozone, again, modulates the immune system to bring that back together, but especially with chronic inflammation. These chronic inflammatory markers and chronic inflammatory genes that stimulate this chronic production of inflammation and cytokines is what makes these chronic health issues so challenging to work with. And so ozone gives us a tool, again, and is made more powerful when stacked with other therapies to help reduce this forest fire of inflammation and then start to rebuild and get us back to where we want to be. So let's talk about let's dive in a little bit deeper to talk about how ozone helps to mitigate oxidative stress and to strengthen these antioxidant defenses. So again, we're going to temporarily increase reactive oxygen species in the bloodstream. And this is that hormetic effect. We're going to come in and kind of say, hey, we're going to stress you a little bit, but it's controlled based on dosage and frequency. So this is why, again, working with protocols and or clinicians who know how to do this based on what you're doing is a good thing. So we're not overdosing to help to cause too much, but we want this controlled oxidative stimulus that triggers the body's natural or adaptive response in upregulating this antioxidant production. And so you can see what some of those are, right? Where we can really help break down and support this healthy function of antioxidant support, which causes this cellular protection so that we can really age well and not have this buildup of these side effects or these remains of the chemical equations used to produce ATP that can cause unhealthy aging and or accelerate neurodegenerative illnesses. So the long-term benefits of controlling this oxidative stress, again, this resilience against the damage, but also this ability to increase or regulate the body's redox signaling so that we're getting these byproducts, this ROS, but we know how to take care of it the right way. So I love the analogy of like, look, during the week, we're going to put stuff in the garbage can in our house because we need to. But we know every Friday where you take the garbage cans out to the curb and they take it away and we're cleaned. That's the body. During the day, during the week, where our mitochondria are going to produce this reactive oxygen species. But as long as our body knows how to come as the garbage collector and take it and get it away, we stay healthy. It's when that balance gets disrupted that we're producing more and more and more byproduct, and the body's ability to get rid of that as the garbage collector doesn't work. That's where we have problems. And so this effect or this benefit can or may be able to slow down this mitochondrial degradation, and so that we can stay healthy longer. Now, oxygen utilization. Another good word for this would be oxygen capacity, or really your body's ability to use fuel. And so we talk about this as far as metabolism, but really oxygen utilization is how well your body uses what it gets in. So we breathe in oxygen and your body has to then carry it where it needs to go. And then it has to be used efficiently and effectively in these chemical reactions to produce ATP or give us this ATP synthesis. So what we know is ozone has the ability to enhance red blood cells so that they can travel more efficiently and more effectively throughout the bloodstream. We also know that it can improve the ability for oxygen to get in the mitochondria, so then it can pump it through the fire to produce ATP, and then it helps mitochondrial respiration. So really, ozone increases the ability for oxygen to get where it needs to. It increases the absorbability of it so that the mitochondria are getting it inside to pump it through with the other nutrients to produce ATP out the end so that we have cellular function. With poor oxygen utilization, all the opposite happened. We don't get oxygen delivered very well, so our tissues start to degrade. And then we have fatigue, and we have weakness, and we have atrophy, both neurologically and musculoskeletally. And then therefore the mitochondria are not getting the ingredients, and oxygen is one of those inside the factory to produce what it needs to on the other end. So the production of these powerhouses of the cell goes down. So therefore we have leading to all the issues, chronic fatigue, we have downregulated immune system, and really our cells, tissues, organs, and systems don't have the ability to do their job. So again, these clinical implications, we know that if you have poor oxygenation, it's going to lead to things like chronic fatigue. It's going to lead to pain syndromes such as fibromyalgia and other neurological conditions and these neurodegenerative diseases. So as we can enhance the body's ability to use oxygen, and again, we're talking about ozone today, but this is also, are we doing proper zone 2 and other exercise? Are we eating appropriately to mitigate inflammation and to increase our body's nutrients so that we have all the right ingredients to produce for our mitochondria to be healthy? And there is some early science out there that shows that this could be helpful. And I've seen this in our clinic too with hypoxia-related conditions such as COPD or other cardiovascular diseases. Again, you want to consult with the clinicians you're working with, but if we understand the science and what I call understand the physiology of what these treatments do, then I can know how to apply it to whoever's in front of me. So let's talk about ozone and inflammation, because we hear this all the time. Inflammation is talked about everywhere. Inflammation is the root cause. Inflammation does this. Inflammation, inflammation, inflammation. I agree 100%. It's also understanding where the inflammation comes from. Is it coming and being produced because of a mold exposure or a mycotoxin or biotoxin exposure? Is it coming from a viral exposure such as COVID? So we know those can trigger different systems in the body. So that leads to, we have to know how to measure it appropriately. But then we also have to understand that these pro-inflammatory cytokines, such as tumor necrosis factor alpha, these IL-1s, IL-6s, these are all initially positive, but it's when they don't shut off that they become chronic inflammatory cytokines. And sometimes we'll use this term like a chronic inflammatory or a cytokine storm, that they contribute to high levels of mitochondrial stress. And they get triggered and turned on because the system can't do its job to shut them off. And so they can lead to this systemic inflammation and sometimes even autoimmunity, hormone disruption, cognitive disruption, etc. And so knowing that ozone has this broad spectrum of being antimicrobial, meaning it helps to fight bacterial infections, it helps to fight viral infections, it helps to fight fungal infections. And so this is why I know I have comfortability using ozone in a bacterial issue, a viral issue, someone dealing with mold, again, whether acute or chronic. I also know that it can help in these low-grade infections that just kind of go on for a long period of time. This is often that patient's like, man, I just feel like when I get sick, I stay sick longer than everybody else in the family. Or, over the holidays, everybody got sick and I've been sick for months, but they got sick in a couple days. Or the person that says, I feel like I just get sick every 4 to 6 weeks. I'm coming down with something. There's more going on in there than you getting a new upper respiratory infection every 4 to 6 weeks. And we have to go beneath the surface to treat that. And so again, we just talked about this, but this infection, which leads to inflammation, lowers the mitochondrial ability to work. So if we can lower the inflammation, then we increase the ingredients getting in the mitochondria and allow it to do its job. Therefore, we can support this healthy energy production. So we've talked about this a little bit as far as how ozone helps with the circulatory system, but it actually improves the endothelial, the lining of all of our blood vessels, and it promotes vasodilation, which is the expansion of our blood vessels so that we can deliver nutrients where they need to go. It increases our natural nitric oxide production. So therefore, not only getting good vasodilation, it can also produce new blood vessel growth. So therefore, we're getting this oxygen and nutrient delivery. So now we can utilize oxygen better. And so here's some good clinical applications. We know that vascular complications and diabetes lead to a lot of the problems that we deal with there, including tissue death, neurocognitive or neurodegenerative disorders, and of course, wound healing. So if we can improve blood flow and really nutrient flow to these areas, then we can prevent or slow or reverse tissue or wounds. We can help with neurocognitive disorders. And then just on a day-to-day, but this brain fog or this cognitive decline that we're feeling or noticing that comes through a number of these, because we're able to get oxygenation to our nervous system and our cerebral tissue. So now let's talk about a second about these other biooxidative therapies and this kind of different type of approach. Now, you've heard me talk about it, then yes, we're talking about ozone today, but really it's more, how does this fit into a full approach? And again, if we're not assessing, we're guessing. So we have to understand, we truly have to know what to look for when we're listening to a patient's symptoms and our history. And then we truly have to know, if we take that, what that means and how we can then utilize these therapies, such as ozone, such as hydrogen peroxide therapy, such as hyperbaric oxygen therapy, such as nutrients, etc., to stimulate this adaptation and this change so that we can help them get better, regardless what the name tags or the symptoms they're coming in with, because we understand how these therapies address underlying cause so that we can fix or support whatever name tags of symptoms and or conditions they're coming in with. So a couple of clinical takeaways. I want to just go through a couple of things of how you can integrate into these plans, ozone, HBOT, supplements, all tied to a proper diagnosis. So none of this at all right now is medical advice, but this is the way I want you to start thinking. So if you are a home user, a patient, to challenge your practitioner and say, how can I leverage this tool set that surrounds ozone to help me get better? If you're a clinician, this is where start thinking how to broaden your thought process of, how can I design really a program, protocol, or experience for my patients to get them to where they need to go? So these are just a few different categories. So we've talked about the neurological and cognitive conditions, everything from neurodegenerative to traumatic brain injury or concussion, post-stroke, COVID, etc. Anything that has a neurological component. So this, again, is understanding the physiology of what got those there, understanding what exposures or lifestyle or things have driven them there. And then how can I leverage things like ozone and HBOT to increase oxygen utilization, to reduce neuroinflammation? I'll tell you, those two things together in my clinic, this ozone and HBOT stacked together, helps reduce and fight the neuroinflammatory fire better than almost anything that I found. And then, and this is just a list of examples, but how can you stack in supplements that are going to help with this neurological aspect of neuroinflammation and helping to produce neurological function? And then how, based on the person in front of you, can you stack those things together in the right dosage, the right frequency, and the right longevity of a program, protocol, or experience to deliver these outcomes of improved cognitive use, so getting rid of that brain fog, helping with that neuroinflammation that leads to brain fog, but also just this chronic fatigue that we see so much now today. And also what I love is both of these have been shown to help increase nerve regeneration. So we actually can produce new nerve fibers to help deal with the damage that's been done by these conditions. So I mentioned this in the beginning. I am a huge SIRS practitioner, and I see this and work with this with patients across the country. So this is chronic inflammatory response syndrome secondary to biotoxin illness, often mold exposure. And it can also come from Lyme and from other different biotoxins. And it drives a number of different things, immune dysregulation, et cetera. And so again, understanding the physiology of what's going on with the patient and what these therapies do from a physiological standpoint, we know that both that we can, one, be antimicrobial and fight and kill these infections. We know we can support detox pathways. One of the problems with SIRS is it's in patients that genetically don't know how to identify these biotoxins from mold, Lyme, et cetera. And they genetically can't detox or eliminate them from the body. And so leveraging things like ozone, HBOT, et cetera, that can support these detoxification pathways and truly help get those things out. We know we can help shut down and reduce the infections, but also the systemic inflammatory issues that have come from these chronic cytokines being driven for so long. And then just improve this oxygen utilization to give this patient more ATP production, more energy, more cellular, tissue, organ, system energy, so the systems can start heal on their own. Understanding what the causes are, again, is huge, so we can know how to use things like glutathione and other binders, other supplements to help, again, through what's going on for this specific condition. So again, we can help them with the symptoms that are being driven from that condition. Chronic fatigue syndrome, fibromyalgia, Lyme disease, again, these are all, again, how can we help modulate the immune system to work that it needs to? How can we help fight the infection? How can we reduce neuroinflammation so that we can boost up energy, stamina, cognitive functions, so this brain fog goes away? And we know that stacking in a treatment plan for the patient in front of us with the right dosage and frequency, we can drive these benefits. Autoimmunity and inflammatory disorders. Now, again, these are all ones that we put them on here because these have name tags. I would argue that a lot of these come out of environmental exposure and or other things that have been triggered and now have turned into some of these autoimmunities. But really, again, using these tools like ozone and HBOT, we can modulate the cytokines. So we can shut the inflammation that's driving these in a person that has the antibodies produced. We can reduce that oxidative stress so that we know these damaged cells, these damaged mitochondria can drive autoimmunity. So as we can reduce that and heal the tissue and then use a great supplement protocol to modulate how the immune system works, bring it into balance, help to detox, we're going to see decreases in inflammation and pain. We're going to see gut health improve, which helps our whole immune system. And then I love this reduced flare-ups. I always talk with patients, the goal is to take the autoimmunity and put it in the closet, meaning flare-ups are way less often. And when they happen, they're not as deep or not as severe because we're living the lifestyle with nutritionally that we need to. And we're doing the supportive work to give our body what it needs to keep this autoimmunity in the closet so it is not affecting us long-term. Metabolic and cardiovascular conditions also see huge. So diabetes, metabolic syndrome, cardiovascular issues. And we talked about how ozone helps to be a vasodilator so that we can increase blood flow, we can increase nitric oxide production. So now we can actually get more nutrients to where they need to. So we're not dealing with these cardiovascular issues. We can help with insulin insensitivity. And again, stacked with the right supplements for the person in front of us, we can help people with their blood sugar control, especially if they're doing this together with the diet and exercise program. But we can really help to decrease the complications that can come from poor circulation because we're using these tools to increase circulation in a healthy way to help heal their cardiovascular system. And then lastly, I'll touch on athletic performance and recovery because that's real as well in our world. And what I've always said, and now I work, if something is going to help enhance athletic performance, it's also going to help us to live healthy and age well, because the mechanisms are the same, just the outcome of the patient that's desired is a little bit different. But we know these tools together, ozone, HBOT, and these oxidative therapies help our muscle recovery. So our patients that use these, who are athletes, say, when I go to practice or games, I'm less sore, I have more energy, and I'm able to function better, as well as having the cognitive to be on and be able to be focused in their training and in their performance. And again, coupling that with the supplemental needs of the patient in front of you. So yeah, can we get people recovered faster? The name of the game in athletic performance, where I worked for years, is how can you recover faster and better than the next guy? And if we know how to do that through increasing oxygenation, decreasing inflammation, and utilizing these tools, then you can truly have an athletic performance up on the rest of the competition. So the final thought on this comprehensive approach, and then we'll wrap up here and we'll have a few minutes for questions. So proper diagnosis, proper diagnosis, proper diagnosis. And to me, proper diagnosis is not necessarily a name tag. That's important to know. Do you have the name tag of Alzheimer's? Do you have the name tag of diabetes? The name tag of Lyme disease? The name tag of SIRS? All that is fine. But then also we need to understand the physiological mechanisms that are driving that and got us to that point. And so what are the labs? What are the markers? What are the other tests that we should be looking at to help us understand the functional picture of what's going on, not just the diagnostic name that sort of gives us a definition of what is going on. And then again, from an approach, it's how can we leverage things like ozone? I have HBOT on here, but also really what other are therapies, treatments, and tools that we can use that give us a synergetic, or what I often will teach or talk about as a stacking effect that optimizes or creates efficiency and effectiveness of our time to give us the health benefits that we need. And then, like I tell everybody, you can do all the cool ozone stuff that you want, but if you are not living a lifestyle that supports healing from a nutritional standpoint, sleep, exercise, healthy relationships, doing the things cognitively you need to optimize your lifestyle, you can do all the ozone HBOT supplements that you want, but if you're not supporting that with healthy lifestyle at the end, it's going to be really hard to get to where you want to be from a health standpoint. And so again, what can all these do? We've talked about these, but some of the overall things, and this is now where we get to kind of patient speak. If we do this right, should have more energy, should have better cognitive function, can reduce pain and help with the immune system, and really just help to get to overall health. So kind of key takeaways today of really what mitochondria do for our energy production and how they work to help with our inflammatory system to make that work the way it's supposed to. And then really how ozone helps all of those by reducing that oxidative stress, enhancing oxygen utilization and delivery, modulating. Remember, modulating is bringing that immune system back to that main function in the middle so it can function the way it's supposed to. And then just getting the nutrients to where they need to be in the system. And so thank you very much for joining us today. I'm so happy that you're all here on a Friday, and what that I know what that means as a clinician, but also as a person, as a user. Thank you for taking time out of your day. We will be sending out the recording and we'll be posting this. You can also reach out to me or to Metaskill if you have any specific questions. If you have questions, someone asked about recommended for HBOT, reach out. We can talk about this. For ozone, I love and use the company Simply O3. That's what we use in our office and in our home. They make amazing, amazing products. And then Metaskill gives some very good home use protocols that you can look at. But again, if you're dealing with something specific like a thyroid issue, it's good to consult a clinician before you go about doing this. But as far as dosing frequency and those types of things, I'm happy to answer those questions. Somebody asked, can you do things like HBOT and ozone on the same day? And the question is 100%. We do it in our clinic and I do it at home all of the time. This is where understanding how to leverage and stack those, you can create efficiency and effectiveness. You know, how can you use those with the right supplements and timing? This is where there's a lot of magic that can be done with the patient when we're truly thinking about the patient in front of us instead of just working with the person in front of us. So people have asked, I see some chats in here about long-term ozone use. What are the protocols? You know, all those different types of things. Again, I'm always very patient specific. Long-term ozone use is never a bad thing, actually. The one thing you have to look at, and we talk about this with our patients, is sometimes up front, we're going to do a high frequency of IV, but then you also want to be considerate of their veins and how that works. And so that's where we might shift to people doing some long-term use at home. I know individuals that have been doing home insufflation multiple times a week for years and might have the healthiest gut biomes out there and are seeing other benefits and changes to everything that we're doing. And so, again, so many different types of use cases. I would say if you have some individual questions about your specific health conditions or infections, I would say please reach out and we can talk about what those are on an individual basis. And we can talk about how those work. I will tell you, every single day in our clinic, we stack and use things like ozone, HBOT in the same day. And we see through lab and through other testing that these improvements happen for these patients with all the conditions that we mentioned today, are all conditions that I have worked with and treat. And on the screen is my contact info and my email. You can also reach out to MediSkill. They are a great ozone education platform that we are doing this through today. And if you have specific questions about your condition or patients that you're working with, you can reach out to us there. I'm so happy to help you. Thank you so much again for joining today. Have a great weekend. And I look forward to hearing from any of you that might have questions, and have a great weekend. Thank you.